On my memo tonight, I'm speaking out on behalf of our healthcare workers. There's no other time when we have needed their services as much as we do right now. They have become our last line of defense against an enemy that is now lurking in nearly every Kenyan neighborhood as the projected peak in infections looms large. However, instead of preparing for the big battle ahead, some of these healthcare workers are now forced to worry about their own safety. They're an unhappy and a frustrated lot. So frustrated are they that nurses and clinical officers have issued a nationwide strike notice beginning Monday next week, in the middle of a global pandemic. Their frustrations arise from the fact that so far 8 healthcare workers have died from COVID-19, while over 700 have contracted the virus. The medical workers say they are working without the vital protective gear, including the N95 masks and PPEs, and that their working environment is not safe. Some medical workers also claim they have not been paid their salaries since May this year. This as questions arise about how COVID-19 funds have been spent since the onset of the pandemic in the country in March. And now the Senate Ad Hoc Committee on COVID-19 has asked the Controller of Budget and the Auditor General to look into how much money was allocated to counties for the pandemic, what has been purchased and at what cost, as well as to check whether there are any irregularities or misappropriation of funds. All this as the corona pandemic continues stretching the country's already strained healthcare resource, where we have 10 qualified medical personnel per 10,000 population, less than half the recommended 22 for 10,000 people. The virus comes with the need for qualified healthcare workers in intensive care, another shortage the country is facing. Kenya has now been forced to look to retired ICU healthcare workers to support those in need of round-the-clock medical attention. A move that has been criticized by some who say those workers are high risk and the opportunities should be given to younger healthcare workers who currently have no jobs. As a country, we cannot afford to have our most crucial soldiers in this war ill-equipped, frustrated, hungry and angry. We must ensure our healthcare warriors have only the patience to think about, not what they will wear or what their children will eat. To leave them to their own devices at this time or ever would not only be a collective national embarrassment, but also a sure recipe for defeat in the face of this unrelenting, invisible enemy. Defeat against this virus means more daily infections, more deaths, more devastation to the economy, and yes, a more prolonged state of national misery. The health workers deserve better, and it is not too much to ask, is it? And that is my message.